Hello Professor, my name is Sabrina Delafew and I will be covering literature review on Mohs micrographic surgery, a treatment for skin cancer. Before I go into that, I'm going to talk about a little bit about what skin cancer is, which is when UV rays penetrate the skin and cause mutations in the cells. The redness, the peeling, and swelling of the skin is caused by the cells trying to heal themselves. However, some of these mutations could be left behind and eventually replicate into an uncontrollable mass, which is skin cancer. Mohs micrographic surgery is the most efficient way to treat skin cancer because it removes as little healthy tissue as possible and it has the lowest reoccurrence rate for that cancer. And the way I'll prove this is by talking about the process of Mohs. First, the visible portion of the infected tissue is removed, and then that tissue is sectioned off, dyed, and examined under a microscope. The results of this show where the cancer is perceived to be rooted deeper, and then they go for a second round and cut off more of tissue in that area, and that process goes back and forth. And when there is no more cancer perceived or seen in the margins of that tissue, then the surgery is considered over. I found that the efficiency of Mohs is established in the recurrence rate, and the recurrence rate is whether the cancer reappears or not. And the way they did this was comparing it to surgical excision, which was the original method to treat skin cancer before Mohs. Surgical excision can also be known as wide margin surgery because that's exactly what's happening. They cut around the infected area with a 2-centimeter margin. The biggest difference to note is that Mohs uses the examinations by sectioning off and dyeing it to see where the cancer would be, and that allows for the least amount of healthy tissue to be removed. Throughout my research, I found that Zitelli was really pro-Mohs, and his experiment just encompassed that argument. He studied 535 cases of cutaneous melanoma, and 99.5% of his patients returned for their 5-year follow-up. And he found in his results that they were historically better than that of surgical excision, and that was because the recurrence rate was only 0.5%. And he also mentioned that Mohs was particularly helpful for areas like the face, hands, neck, and feet, which we all know are genital areas, proving that Mohs can be efficient even in the areas that need the most caution. However, there were also some arguments that were kind of indifferent between surgical excision and Mohs. For example, Smeets did a study on primary facial carcinomas and also recurrent facial carcinomas. And throughout that, Smeets found that the results favored Mohs, but the difference was so slight that it couldn't really be said that Mohs was better. And that was because the differences in the reoccurrences rate were only like 1% for primary and 2 to 3% for recurrent. Moving on, I still believe that Mohs micrographic surgery is the best way to treat skin cancer because it removes just as little healthy tissue as possible and it has the lowest recurrence rate. In surgical excision, it's kind of a guess and check. They don't really know whether they're getting all of the cancer. They could remove too little of the infected or too much of the healthy tissue. That said, Mohs is superior to that because they don't have to go through the guess and check process. Also, Mohs is said to have been really well in other sorts of infections in the skin, but there hasn't really been a lot of research to prove that. So in conclusion, my literature review is over the efficiency of Mohs, and I hope that you continue to research in skin cancer.